Hello students, we will discuss a on-table operative finding. Let's see and tell what exactly it is, then we will have a brief discussion. So what this on-table finding is, look at this, I will tell this is the breast tissue, there is an incision and some mass is coming out. So what is this and what surgery is done, what condition is, what is the incision? Just think what is this on-table finding. So it is on-table fibroadenoma breast. See that typical fibroadenoma, all of you know that. It is benign encapsulated tumor of the breast. It is hyperplasia of single lobule of the breast. Aberration in the normal development and involution. A&D, it's a part of A&D where it is hyperplasia of the lobule, single unit of the lobule. It's a part of A&DI component. Of course, it's a benign tumor, remember. Types are soft, hard, giant, more than 5 centimeter. More than 5 centimeter is called as giant. Intracanalular and pericanalular are histological type. Intracanalular is a soft, pericanalular is a hard type. Ultrasound breast is a must. And axilla, of course, lymph node if it is not, it's a differential diagnosis, it's a carcinoma breast, but it is freely mobile, not attached to the breast tissue, very freely mobile in all quadrant, and it is called as mouse in the breast often, occurs in the young age group, adolescent, second and third decade individual, sometimes bilateral, sometimes multiple, sometimes small, sometimes large, sometimes hard, sometimes soft, sometimes giant. I have told the meaning. So FNS is a must, of course, to rule out malignancy and confirm the diagnosis. And treatment is excision under general anesthesia. Now incision placed are under GA, that's important. Webster circummedullary incision and Galliard-Thomas incision. If this is the nipple, this is the areola, this is the breast tissue. If you put in the areolar margin, this is called Webster circummedullary incision. If you put submammary incision like this, usually laterally, that is called Galliard-Thomas. In the large one you can put. Most of these, this is a circummedullary incision is put for this big one because it comes out, because it's encapsulated. You can enucleate it. Like this you can put it out. So with a small incision we could retrieve it. Then of course subcutaneous incision along the circummedullary area incision, if you put, then cosmetically it is very good. Of course, if difficult one, then you don't compromise because the entire mass has to be come out. So you put a Galliard-Thomas submammary incision. So that is about fibroadenoma. So you can go through in detail how to examine breast cases. It's a very important long case kept in the exam. Oxy they will keep, and Viva they will ask, MCQs will be asked, and also theory they will ask, early breast cancer, fibroadenoma, short note, long cases, long questions, everything will be asked. So many differential diagnosis for breast cancer also will be asked. So you can read my clinical method in surgery, how to examine breast lumps, and my SRB anal surgery for detail about all breast conditions, including mammography, evaluations, everything, and therapeutic aspect, and operative surgery for how to do mastectomy, how to do excisions, how to do incision and drainage of the breast abscess, and suturing technique shows suturing skill actually with the video. Of course, did you know my lectures extensively? Everything is covered for UGs with the CBME, for PG to beginners, including specialties briefly, operative surgery, X-ray instruments, and specimens with the clinical examination also briefly. So you can always subscribe for a year to have a clear idea to face the exam. So students, I hope you understood basic about fibroadenoma breast. Thank you very much.